Warm welcome, dear friends, to the 41st edition of 4D, Detailed Discussion and Dialogue in Indian Diabetes. In this series, in 4D, we have tried to share a four-dimensional, a multi-dimensional view of diabetes. We've talked of challenges and barriers, but we've also talked of solutions and bridges. And we've gone to each and every corner of the country to see what is it that unites us in our diversity. A united challenge that we face is that of diabetes. The situations, the healthcare systems may be diverse, but then another thing that unites us is our zeal, our enthusiasm, our approach towards converting ourselves from being known as the diabetes capital of the world to the diabetes care capital, to the diabetes control capital of the world. And this is possible if only we all get together, if all of us get together. And here we have today with us a very bright, a very dynamic endocrinologist of the country. A warm welcome to Dr. Pankaj Patwari, endocrinologist at Apollo Clinics in Guwahati. Warm welcome, Dr. Pankaj.
Good evening, sir.
So, Dr. Pankaj, you've studied in different colleges of the country, in the prestigious Dibrugarh Assam Medical College, then in Guwahati, and then in the very prestigious IGPMR Kolkata. And then you've come back to Guwahati. So, and it's a multi-ethnic population that you look after. What is it that you like most about the challenges of diabetes care?
Sir, the most important was the patient education and the awareness. Till now, whenever I deal with the patients in the OPD, I find there are some challenges that the patient are yet not aware about the diabetes, the symptoms, the complications which can happen, and especially the kidney complications. Most of them know the cardiac and kidney, but the eye complication, nerve complication, foot problems, and not only the patients, even some of our healthcare staff. I should not tell the name, but even they find it difficult if I ask suddenly them the question that how to check the sugar, when to check the sugar, they will be in a confused.
Ex-
They won't be able to give the right answer. Even some of the times in our ward, our sisters, when I ask them what was the sugar, they just tell, "Ha, this was the sugar 120." If I ask them when it was checked, oh sir, ये तो खाने के just बात किया.
The challenge is awareness, and the solution is education. Now, it's very famously said that a prescription, a diabetes prescription, has a paracrine effect. So, what does paracrine mean? We'll request Dr. Pankaj to speak about that. But when you educate a patient, that has an endocrine effect. Suddenly, the effect magnifies, it goes across the country. So, today, Dr. Pankaj will be speaking to us about challenges and solutions for type 2 diabetes management in India. And while he speaks about that, we'll ask him to dwell upon this and share with us his ideas, his concepts. Is it true that if you write just a prescription, you will get paracrine effect? But if you add education to that prescription, then it suddenly becomes endocrine. So, Dr. Pankaj, warm welcome once again. Entire India looking up to you and wanting to listen to your views and share your experiences.
Myself, Dr. Pankaj Patauri from Apollo Excel Care, Guwahati. So I shall be today discussing on diabetes and the challenges and possible solutions, especially in our Indian context. So, what are the common challenges for diabetes care in India? So, these are the common headings like improve education to alert the population about the risk factor for diabetes, training of patients uh, to manage their disease more effectively, development of more structured care delivery, and management of cardiometabolic risk. So, just in short, still now, what I find when in our OPD or daily practice, what I found that most of the patients when they come, they have little knowledge about the diabetes. Means whenever they find that there are symptoms of hyperphagia or increased urination, they will go and check their sugar. That much is okay. But what after that? What are the complications? Means what are the things they have to do once they are diagnosed with high sugar? How frequently they have to check their sugar? What are the complications a patient can have or diabetic patients can have down the line? Something they know, but everything even we don't know. But their awareness part is a bit lacking. So it becomes a very challenge in OPD when we can give hardly 5 or 10 minutes to a patient. So to describe all those things to the patients. So generally nowadays newsletter and news media or this TV channels news, they are taking cover of this diabetic problem, but still now most of the patient doesn't know how to monitor their sugar, how frequently to go, what are the other organs which can be involved, like the retinopathy, like the foot ulcer, how to take care of the foot, which is a very important part of the this diabetic management. So this thing, the follow-up the medicine, and apart from our pharmacotherapy, the lifestyle measurement, how to do, what to do, the exercises, the diet, what can they eat, their local, whatever the staple foods which are available, how they can enjoy their food. So all those things are still lacking. Whenever I see a patients of diabetes first diagnosed, they become anxious that now we'll won't be able to eat many foods. We'll have restricted items. So it's not like that. Still, that awareness is lacking. And about the exercise, we know that India is the home to yoga, and still the patient asks, "What exercise should I do apart from walking?" And I feel like you are in India, you have the best exercises in the world. The people are the Western people; they are taking our exercises, and you are asking me the same question. So I have to elaborate these things: the yoga, jogging, cycling. In fact, what I give them that at least see 30 minutes of Ramdev Baba yoga and learn something exercising. And in our local, whatever I try to do is ask the people to do the singing and the dancing part, because if the people do some physical activity in the form of dancing also, so they feel happy that at least something related to our culture or something which I relate we can do. So all those things are still lacking: the physical activity, the diet. I shall also discuss the diet, how the people are still unaware what they should eat, what they should not eat. And whenever they come, they will have some small questions. Can I eat this? How much milk should I have or not? Can I take curd? Can I take salad? Can I take vegetables? So all those small questions the patients have. So still there's a long way we have to go for educating and making aware our patients about the diet, about the physical activity, but how to frequently to monitor, when to go to emergency for urgent care, how to manage hypoglycemia. So all those things are still has to be addressed. So it is essential to diagnose the disease early and start aggressive management of glycemia and associated cardiovascular risk factors. Also mandatory to individualize the glycemic targets considering the comorbid conditions. Because just one example I would like to give: suppose a newly diagnosed patient has come, young patient. So in that patient, my glycemic target will be different. And suppose a CKD patient, CKD stage 5 on dialysis, the patient has come. In those patients, even if we give a little bit high dose of insulin, they may go in hypo. So in those patients, my target, my insulin dose will be different. So all those things has to be individualized. Now, what are the possible solutions? First, we have to identify the barrier to diabetes management. So it is necessary to improve the quality of diabetes care, including the improvement of metabolic control and diabetes self-management. What are the barriers? Patient-related barriers such as lack of awareness, economic stress, denying the risk, stress, changing behavior, sustaining the changes are difficult. Again, coming to the stress management, what I tell my patients, because stress, everything will go wrong, be it sugar, be it pressure. So everything will go wrong. So stress management becomes very important. In that case, what I ask them, how to manage their stress: yoga, meditation. Yoga is innate to the Indian culture, and meditation, and plus singing and dancing, because the people feel good whenever we ask them to do something which they are acquainted with. Now, coming to the rural barriers such as high rates of illiteracy, poverty, different socioeconomic strata, multilingual population, cultural, religious, and custom, superstitious and beliefs, and barriers related to the medical profession, including the training focused on acute care. Even nurses and find acute illness treatment more rewarding and better paying, and the cost of having a team for diabetes management and lack of trained paramedics. So these are the some of the barriers which we come across. Suppose I ask a healthcare staff to check a sugar 6 hourly. What they do, they don't ask the patient when they had their last meal. Suppose the patient had something meal 30 minutes back, and if I ask the write an order to check the sugars 6 hourly, they won't go and ask when she had the last meal. Suppose the patient had meal 30 minutes back, and if her timing to check the sugar has come, suppose at 2 p.m. she has to check the sugar, she will just go and directly check the sugar. She won't ask the patient that when did you had the last meal. Suppose the meal was 30 minutes back, then she should not check. She should wait for at least 90 minutes to 1 hour. But these are the small barrier which is still are the awareness problem is still there. Like when to check the sugar, how to check the sugar. Some of the patients they come, and what they do whenever we ask them that in the follow-up you come with fasting PP, they switch off their insulin or medicine on the day, and they check their sugar and come and tell that on the day we didn't took the medicine, in order to see whether our diabetes got reversed or not, or the diabetes has been means the level of diabetes has decreased or not. So these are the common problems which we face. So whenever I try to explain that it's not like that. The fasting is fasting. You don't have to take the medicine, but the postprandial, in that you have to take your medicine, insulin or tablet, and then I want to see whether that medicine is working or not, whether I have to increase or decrease the dose. but their way of thinking is different. Even the lab technicians who does the test, they also give them the wrong message. That on the day of the test, don't eat anything, your medicine, and just come directly for the test. So those are some of the small points which I found in the OPD in the daily practice. Now, what are the strategies to manage prediabetes? The link between prediabetes and cardiovascular complication has been established, and physicians should be aware of the implication of their patients. At this time, major organizations like ACE has published written statements on the importance of diagnosing and treating the prediabetes population. Following these steps will help ensure that future complication in this subpopulation will not take a toll on our healthcare system. So in the first step, managing patients with prediabetes is to encourage strict lifestyle modification like exercise, 180 minutes of physical activity per week, and calorie intake of 1200 to 1800 calorie per day. Then, in addition to lifestyle management, anti-obesity agents such as orlistat, lorcaserin, phentermine, though we don't use all these, we sometimes orlistat has been used and GLP-1 agonist has been used. They should be considered for obese patients with prediabetes. And healthcare providers, they can also consider pharmacologic agents like metformin, pioglitazone, liraglutide, acarbose for management of prediabetes. So if medical management fails to achieve glycemic control, advanced measures such as bariatric surgery can be used with the goal of reversing prediabetes and helping obese patients lose weight. So, in short, whatever our message should be, what is the paracrine effect of writing a prescription and what is the endocrine effect? So, paracrine effect is whenever we write a prescription, we just write the medicine, we just tell the patient to take the medicine. So, that is just a small solution to the big problem. And when we educate the patient, make aware of the diet, of the physical activity, what are the complications the patient can have, how frequent to do the food examination, eye examination, urine test. So that is educating the patient, making them aware of the symptoms of diabetes. So in that way, we are making an endocrine effect. Just writing a prescription is a paracrine effect. And if we educate the patient, it becomes endocrine effect. That means not only the patient, we should also target the patient, their relatives, their friends, because whenever they go at home, in the evening tea, they will discuss these things, whatever we have discussed in the OPD. So some of the patients, what I do, I used to call them together, two patients together. So what I found, I asked them to talk, discuss the things, and they were discussing that I took this giloy, I took neem, I took this neem, methi, jamun, and they were discussing among themselves in front of me that I took this, and with this my sugar got controlled. And in fact, some of them went ahead and said that we bought insulin plant from online and our sugar get controlled. So that is a bit too far. But the local things which they are using, like the neem, methi, jamun, giloy, I don't tell them not to use. I tell them yes, you can use this. These are good, stable food, locally available. You can use it. But along with that, you also take my medicine, also do the physical activity and diet control. So they also find it to cope up with my medicine, and I also find it comfortable to give them the message of lifestyle measure, diet control, plus the local cuisine, like in our Assam, some of the things, the fermented foods which are available, which they make, like the aloo pitika or the fermented bamboo shoot. So the people are very comfortable eating those things, and we know the fermented products have this prebiotics in them. So the gut microbiome. We also know that how the gut microbiome decides our metabolic, all the changes, the diabetes or the pressure or the this metabolic complications. They are regulated by the gut microbiome. So if we can control our gut microbiome, a healthy gut microbiome, we can also have a good control of our diabetes. So we know the fermented foods have pre-probiotics, especially prebiotics. So I ask them if whatever locally available, the fermented foods which they are using, like the aloo pitika or the fermented bamboo shoot, even the fish, they have procedures how to keep the food, the fish, uh, in some special this container with some little oil and some fermentation, their own local methods, so that in that way they can preserve that food for a pretty long time, so that they can use it after 2 days or 3 days and they eat. So that gives them the added advantage of prebiotics. Some of the locally available foods in Assam, fermented foods like the horika, then the kahuri, then kharoli, that means the rapeseed, which is alkaline fermented, which the people find it very good to eat. So I ask them that you can use them. So the people also becomes familiar. I mean, one-way discussion happens between me and the patients. So the patient no longer become patients. Apart from that, the singing and the dancing, the view which is very popular in our Assam, I ask them that if you don't like to do some exercise apart from walking, at least do view dance. You are comfortable with it, at least 15 to 20 minutes per day, 3 to 4 days a week. Practice it, or whatever local dance which you are doing, because in other states of the northeast like Mizoram, Manipur, or Shillong, the dances are different. So I ask them to do whatever locally the culture is there, so that at least 15 to 20 minutes of physical activity will be there. All the parts of the body will move, so all the parts get energized, you get motivated, the stress is released, and in that way I try to convince my patient. Now, coming to the strategies, novel medication therapy, they are used with diet and exercise to control high blood sugar in adults with diabetes are DP4 inhibitor. We all have been using, so nothing new. Sitagliptin, linagliptin, alogliptin, saxagliptin. I don't use, though it's there because of the this. And SGLT2 inhibitor, canagliflozin, dapagliflozin, empagliflozin we have. And GLP-1 like the liraglutide, Victoza, Ribelsus, and semaglutide we have been using. So early initiation of combination therapy, so achieving glycemic control early and delaying the deterioration of glycemic control with possible better preservation of beta cell function becomes an important. And for example, metformin with SGLT2 inhibitor provide a combination of early efficacy and reduces the risk of hypoglycemia, weight gain, BP, cardiovascular benefits, and renal failure. So pharmacotherapy, we all know, we have been using it. But apart from pharmacotherapy, if we can give the freedom to our patients of enjoying the food, the diet, and the physical activity, not only the uh, like the aerobic or the resistance exercise, which are, because it is not possible for all the patients to go to swimming or to go to gym or to have some particular exercise or keep trainer. But if I can ask them to have some simple exercises like hand exercise, shoulder exercise, belly exercise, thigh exercise, the yoga, which incorporates most of the exercises for whole of the body, and the dances which are prevalent in our regions, if they can incorporate those in their daily life at least 20 minutes, so I can we can control their sugar with little dose of medicine, and the patient will also be satisfied. So other actions, patient education, both of them are key steps in ensuring good glycemic control. Other facility and adequate manpower of these are not available even in the major cities. The priority must be given to creating awareness among public and to patient education. And patient education programs are generally cheap and cost effective. So telemedicine strategies can for closer monitoring and intervention to achieve not only better metabolic control but also to help in the global care. And over the last decade, several studies have addressed the feasibility efficacy of telemedicine. Most studies have proved it to be feasible in general in specific clinical situations. So as we know that we give our number to the patient and we tell them to WhatsApp the reports and the prescriptions, so that it becomes very easy for us to handle the situation. Suppose the patient is having high sugar or very low sugar, so and if he cannot come because he's in a periphery, like he just WhatsApp us the report. What I do to my patient is he will just WhatsApp me or ring me up so that I can answer him that immediately you do this. If the sugars are low, what to do? If the sugars are high, what to do? The patient will also become very comfortable that the doctor is available, though not physically available, but at least through phone. So it becomes very easy to handle the situations. So with this, I conclude and ask sir to take over. Thank you.
Thank you, Dr. Pankaj. That was wonderful. And we have lots of questions coming from the audience for you. One question, which seems to be a slightly naughty question, is sir, awareness in Dibrugarh, in Guwahati, in Kolkata, in different parts of the country. Can you share your experiences? Is it true that one particular population may be more aware, more numerate, more literate, and other populations are less aware, less numerate, less literate in terms of diabetes care?
Yes, sir. Subtle differences I have found, but as a whole, I found that in India, whichever states I have traveled, especially the northeastern and the Kolkata, I have found that the patients, the diabetic awareness, though they think that they know many things, because nowadays in the news channel and in the newspaper, everywhere they will get to find something about diabetes. So 50-60% of them know at least about the symptoms, and they at least try to check their sugar. But what can happen next, how to do follow up, how frequently to check, and what are the complications which may happen, all those things are still not clear. And especially one important thing I'd like to highlight here, especially the sugar, how to check the sugar. Suppose the patient is already on medicine, whatever a small mistake which they generally do is on the day of checking the sugar, they will stop the medicine or the insulin and they will check the sugar in order to find that how much the sugar has been controlled. So whenever I tell them that please don't do this, fasting is fasting without medicine or insulin. But the PP1 actually you should do take your medicine or insulin and then check the sugar so that I can know how much I have to increase or decrease the dose. But their thinking is on the day they will stop the medicine and they will see how much the sugar has been corrected, whether the diabetes has reversed or not. So these small things I found, and especially whenever in the hospital I found a common mistake. What they do whenever we ask them check sugar 6 hourly or 8 hourly, the staff what they don't ask the patient that had they had their meal within 1 hour or 2 hours. They won't ask. They will just go because they are in a busy schedule. They will just go and check the sugar. They won't ask that had she had something snacks half an hour back because that will give a false reading, high reading. And next day if I come and if I see that sugar, I may increase or decrease the dose. So these are the small things I found.
So that's true. And then that means checking glucose, that is like exocrine effect, of the pancreas. You eat something and then the pancreas releases its secretions. But what is going to happen before and after, that is the endocrine part of teaching. Some specific questions coming up. You have spoken about solutions. So one solution is physical activity. Sir, can you share any folk dances or any martial arts of Northeast India, which we can popularize not only in the Northeast, but across the country? Things that are happy, things that encourage teamwork, and things, activities which will make us become more physically active and also help us control our glucose and weight. So any best practices from Northeast?
Yes, sir.
Folk
So
dances and martial arts.
yes, sir. So especially whenever I ask my patient for the physical activity, they know one thing is walking. But I ask them not only walking, be it jogging, be it Zumba dance, be it any sort of dance, be it yoga, they can do. Especially for our Northeast, in the Assam, the Bihu dance is very popular. So I ask my patient that if you are comfortable doing that dance, Bihu dance, at least 20 minutes a day, even if you do practice, not every day, 4 days a day. Bihu dance is, it is very hectic. If you do it for 20 minutes, it will make you sweat. So at least
Yeah.
if you're comfortable, because when you dance, when you sing, you feel good. And if you're a diabetic patient, if you're dancing and singing, so that part I can touch the patient's sentiments. That you dance, whichever you are comfortable, those physical activity, and the sugar will get under control.
I'm also fond of dancing, and I think everyone listening to you wants to do the shoulder moves, the Bihu shoulder moves. And if we can create something called Bihu Bhangra, which will have both proximal and distal muscle involvement, both upper limb and lower limb and trunk, I think that would be ultimate. So, Dr. Pankaj, work for us now. For all of us in 4D, we'll create a new dance form known as the Bihu Bhangra. And hopefully, we should be able to improve diabetes with that. Another question relates to diet. And again, speaking of the Northeast is famous for its unique cuisine. And one specific aspect of Northeastern cuisine is the focus on fermented foods. Now, when you have fermented foods, you automatically get more of probiotics. So, two questions coming up here, Dr. Pankaj. The first is, how good a cook are you? And the second is, irrespective of what you answer for the first question, could you share some fermented dishes from Northeast India, which actually will improve GI health, gastrointestinal health, which will improve the metabolic, the microbiome of our gut, and which will finally end up improving the metabolic profile?
Yes, sir. So I am good at making tea. So the answer to the first question.
And at honesty, how about tasting fermented foods? Are you good at tasting?
So sometimes I have to.
Yeah. Okay, good. Yeah.
So then, coming to the fermented food, yes, sir, it's very popular in this part of the country, and some of the good aspects, as you said, the probiotic part. So, like dahi, curd, which we use. So, if we keep it, it's what we do. The night we keep the milk, we add something, and the next day we get the fermented. Means this changes, and especially it's not the sweet milk. If the curd is sour, then it has the more prebiotic probiotic effects. So similarly with the some of the sprouts, we keep them at night with underwater, and the next day if they get sprouted, they become very good. Especially some of the other local foods, the fermented, the local cuisines. I mean, the bamboo shoot and all those things which the local in the village they use. we keep it at night. The next day, they in the morning, things get fermented. So you can say in a form of sprouting, which we use for the pulses. Same thing, the foods get fermented, and the prebiotic probiotic effect which we get,
The other
we don't get that microbiome.
the other fermented foods that we have in Assam, like aloo pitika or fish pitika, so they are also things which will, first of all, they're economical, they are locally available. Secondly, food perishability reduces, so you are able to keep the food for a longer period of time. And most important of all, when you take these fermented foods, your microbiome becomes healthy, it becomes happy. And this would be 4D would be actually a very good platform for us to encourage people to learn uh, to learn culinary medicine, to learn how to prepare fermented foods from different parts of the country. So thank you, Dr. Pankaj, for sharing your experience with us. We are speaking of solutions today. We have spoken of physical activity. Bihu Bhangra has come up. We have spoken of diet. So fermented foods, and Dr. Pankaj now will first of all learn how to cook, and then he'll learn how to teach us, and we'll learn from him. We promise to be very good students, Dr. Patwari. Third would be stress management. So the tablets, the injections, we are all aware. But any unique features of Northeastern culture which keep us happy, which keep us healthy and in harmony, and which also reduce our stress? Any best practice you would like to share with
The dancing and the singing, which is very much popular in the Northeast. The people are very fond of dancing and singing. So if people who are stressed, apart from yoga, apart from meditation, at least some time if they can give for the singing and the dancing part, they will also feel good. At least 20 or 30 minutes to the singing and to the dancing. Physically also they will be good. All the parts of the body can move. And when you are singing, the right side of the brain works, and some frequency happens, something happens, then your body is in a good vibration mode, and everything become you get positive results of everything when you are in a good mood. Your body gets something energy to fight whatever metabolic complications you may give. So this singing, dancing, stress management with yoga, meditation, if people apply in their life, I think we as an Indian, we have forgotten our own yoga, and we are more towards the Western, and they are using our yoga and all our Ayurvedic medicines for, for their benefit. And sir, one more thing in the diet I would like to say, though I don't directly ask my patient to go to take Ayurvedic medicines because since we are practicing allopathy, but I ask them that if they are comfortable with taking neem, giloy, methi, jamun, which they can take
yes.
because if available, so they can take it. I don't say no to all those things because they are good. They are our, I mean, regional or stable things which they can take, and they are
It
comfortable.
is
The patients feel better when they hear the word herbal or Ayurvedic. When they hear, they becomes comfortable. Oh yes, I can take at least little bit of this.
It is true. I would like to reinforce what Dr. Pankaj is saying. And though honestly, Dr. Pankaj is young in practice, he is speaking with a lot of wisdom. If you are able to integrate both things together, the functional foods. So, see, Dr. Pankaj clearly said don't give medication. There will be more drug drug interactions, but you can give the functional foods. But you do that with the rationale. So, a person with type 2 diabetes, person who is obese, something like methi ka pani, jeere ka pani, this will help. Of course, don't give it to a person with type 1 diabetes who's already malnourished. Don't give it to somebody with pancreatic diabetes who, as it is struggling with absorption of food. Avoid in somebody with celiac disease. You don't know what will happen. And if the person is taking thyroxine in the morning, tell the patient to take it 4 hours away from the thyroxine, either earlier or later. Same for semaglutide. But otherwise, when you do this, the patient does feel comfortable. Uh, to stress management, to what Dr. Pankaj said, I would like to actually again reinforce singing, dancing, and some best practices we get from the Northeast. You go to Mizoram, such beautiful music. Everybody is singing and they sing together. It is a choir. That is the point. Singing together.
Oh, yes,
You look at any Northeastern dance, or you go to Odisha, you go to Jharkhand, they sing in a circle. Same thing is true for Uttarakhand and for partly for Himachal, but for Uttarakhand, yes. Why do you sing in a circle? Again, teamwork.
yes,
And now you look at classic dance from across the country, you look at folk dance from Northwest India, it is not necessarily a circle. There will be teamwork, but it's a different kind of teamwork. So the circle, I think, reinforces harmony, teamwork, being together, working as a community. If
Yes,
you're
sir.
sad, you are sad together. If you're happy, you're happy together. And most important of all, if you're healthy, you are healthy together. So it reinforces the fact that the community has to work to fight diabetes. And if we are able to inculcate that in our patients, before that in ourselves, I think, then we have won the battle.
Yes, sir. Thank you.
Dr. Pankaj, it's been great having you with us. And honestly, I would like to commend you for the wisdom that you have shared. Wisdom in terms of pharmacological therapy for diabetes, and then the wisdom that you have shared for non pharmacological therapy. I
Thank
would
you, sir.
also like to commend and thank everyone for having joined us today. So, what we've learned is if we want to change India, if we want to make ourselves the diabetes care capital of the world, certainly we will use whatever drugs are available. But we will use local cuisine, local functional foods, local dances, local methods of stress management. And we will not shy away from innovating, from creating new dance forms. So, work for all of us, I think, is to begin working on the Bihu Bhangra for this year. With this, I'd like to thank everyone for being with us. Dr. Pankaj, thank you once again for making 4D a success and for adding so many new dimensions to 4D today. Thank you.